As Congress does what is necessary to respond to the coronavirus, unfortunately, the Trump administration's efforts leave much to be desired. While the Trump administration's response is slow, halting, and loose with the facts, and President Trump blames everyone but himself, Congress, the Democrats and Republicans, House and Senate, are acting like the adults in the room. We're not letting President Trump's accusations and nastiness, his false statements, and his inability to really grapple with the problem and instead try to brush it away, get in our way of doing what America needs to have done and done immediately. Congressional appropriators have had to include provisions in the emergency bill to prevent the administration from stealing funds from other public health and disease programs to fight the coronavirus. That's what the White House wanted to do. Test kits were not as widely available or accurate as they should have been in the early days of the coronavirus outbreak. Politico reported this morning that the administration was very slow to develop an accurate test for coronavirus and slow to allow hospitals and public health labs to develop that on their own. The emergency funding bill seeks to deal with these two issues. It explicitly funds laboratory testing. We may have to do even more in the weeks to come, but that is no reason not to immediately give a generous appropriation so that testing can be done. Every day we delay testing, every time a person who needs a test doesn't get one, is a day, a time where the virus gets worse and worse and worse and can spread. There are still major issues with the lack of testing infrastructure that is being provided by the administration. States and cities still don't have enough tests. And yesterday we heard from the National Indian Health Board that the Indian Health Service and tribal health facilities are being left behind in the coronavirus response and have received few, if any, resources. That's unacceptable. And meanwhile, as Congress works, Democrats and Republicans, House and Senate, to come up with a strong, comprehensive bill with the necessary dollars, President Trump continues to spread rumor, loose speculation, and happy talk. If any member of the administration tells the president something optimistic, he repeats it and exaggerates it to the point of absurdity. The president said the disease might magically disappear once the weather gets warmer, and promised that the vaccine would arrive soon. His words. Only yesterday were a group of governmental health experts and pharmaceutical executives able to convince the president that a vaccine won't be ready in a matter of months, as the president believed and said, and in fact could take a year to develop. We need leadership in this country. We need serious leadership at a time of crisis like this. We don't need the facts being brushed under the rug. We don't need executives being told, just do happy talk. Don't tell the American people the truth. We don't need a president who doesn't know the facts and blithely states whatever pops into his head that he thinks will benefit him for the moment. This is a crisis. There's no substitute for credibility and honesty from our political leaders. We need the president and his team to level with the American people and tell the truth, more during a health crisis than ever before. Our public health professionals must tell the president the facts, and the president and his team must tell the American public the facts, just the facts. Now, the Vice President and Ambassador Debbie Birx will speak to both Senate caucuses at lunch today. I'm disappointed that Dr. Anthony Fauci, the director of the National Institute of Allergies and Infectious Diseases, who was originally slated to join us, is no longer coming. But Senate Democrats have many questions for the Vice President about his administration's response to the outbreak, and even more importantly, what they're doing now to help deal with the problem as it gets worse and worse. We look forward to pressing them on the need for transparency and decisiveness, and hopefully getting useful answers, because the health and safety of the American people are at stake.